Hello, my name is Jim Dice, and I'm one of the registered nurse owners here at Twin Oaks Home Care. Welcome to the staff meeting, the fall 2013 SAF meeting. What I have for you here is an agenda. Everyone should have gotten one, and it has two handouts with it. Number one on our list is winter safety. It snows 6 months out of the year here in southwestern Pennsylvania. There's some things that you can do now to make sure that it's going to be a little safer for you this winter. When you are driving, it's not going. That's the problem. Normally it's stopping. So don't be braking really hard and go slower. You also want to stock up some supplies in your car, including blankets, flashlights, even like some Fiber One bars or granola type bars, some food in case you do get stuck somewhere and it takes a while for someone to get to you. You want to leave earlier this winter. Normally if it takes you 20 minutes to get to a house, you want to leave 30 minutes before, or if it takes you 10, you want to probably leave 15 minutes before, because we still need to be on time at our patients' homes. Next, it's a good time to take a look at your tires. If the treads are gone on them, it's a good time to go ahead and replace them now. Don't wait until after the first snow flies, whenever everybody else is going to get them. It's real hard to get them then. You might also want to put some studs in your tires, especially if you're around the mountain areas. You get a lot better traction whenever you're on hills going up and down, especially in icier conditions. I had those on mine one year when I was a registered nurse working for Albert Gallatin Home Care up on the mountain, and it worked great. And last, if you don't have a cell phone, I would suggest getting one. The prices of them have come down a great deal. They're very inexpensive. You can even get some online and just have it activated for a small monthly fee. That's probably one of the best things that you could have on you is to be able to get a hold of someone in case there is a problem when you're out on the road. Number two, our infection control. Annually, we have to do TB training, and for those of you that are due, you'll be getting your TB shot following the meeting here. For those that aren't familiar with what TB is, it's a respiratory infection, and it is transmitted by mucus droplets, coughing, sneezing. Someone that has active tuberculosis, there is a difference between active and inactive. Active tuberculosis is when they can actually give that infection to someone else. Once someone else picks it up, it goes down into the lung. It can stay there for 20, 30, 40 years before it actually becomes active and can cause a problem. If someone ever tested positive for a TB shot, which means they have it and it's inactive, we would never give them that shot again. They would have to go to their doctor and get a chest x-ray. MRSA is another infection that we are seeing a lot lately. It's methicillin-resistant Staph aureus. That is a bug, an infectious bug that gets into someone's system, either in their urine or their sputum, or maybe could get in their blood system, or if they have an open wound. It's very difficult to treat, and antibiotics, a patient may need to take antibiotics for about 3 months, if that's ever the case. Good hand washing prevents the spread of that. And wearing gloves, if we're going to be handling anything that's soiled with wound drainage or urine or feces. And last, any infections that you see out in the community with any of our clients, or even any of our employees, call them into the office. We do have an infection control log that we track infections on a regular basis. Number three, moving on, Adult Protective Services. You will find a handout that we're going to give you. This was sent from the Office of Long-Term Living on the importance of us in the community seeing abuse and neglect and reporting it appropriately. If you're in a home and there's an emergency, you call 911 and then call us afterwards. But anytime there's a report that's going to go to Adult Protective Services through one of my employees, you should give us a call here at the office, discuss it with your supervisor, and then we'll go ahead and we'll even assist you in getting that referral made. Number 4, reviewing. This, we always do policy review. This time I decided to do it just a little different. I always list dues every year for 14 years. This is what you're supposed to do. This is what you're supposed to do. Well, this year I added, this is what you are not supposed to do. And I called it do's and don'ts. So the do list is A through R, and the don't list is A through F. We'll start with the do list. This is what we need to be doing when we're out working in clients' homes. Do call the patient doctor's appointments into our office, because we may need to make sure, they only want one girl transporting them. So we have to make sure that girl's scheduled there that day. So if you call their doctor's appointments into the office, that helps us schedule a lot better. Things will run a lot smoother, and that's the whole purpose of even us having these meetings, is so that everyone's on the same page and that everything's running smoothly. Letter B, turn your cell phone off when you're in a client's home. Now, you can take your cell phone with you in case there's an emergency. You can turn it on, you can call. But when we're in the home, our policy is our cell phones are to be off. That way we're there caring for the patient and meeting the patient's needs, and not being selfish and being on our cell phone, either reading or playing games or Facebooking or whatever. Letter C, do keep your purse in the car. And the reason that's there is because I don't want visitors at a patient's home going through your purse whenever you say you're in the bathroom helping them. That can easily happen, and it has happened in the past. So to prevent it, when you go in, only take your car keys, put your cell phone in your pocket, and go head in. And also, you want to leave your personal problems outside the client's home. When you're going into a patient's home and you're telling them about all your personal problems with your kids, your boyfriend, your husband, hopefully not both, your job, other clients' homes, leave that stuff outside the house, because what's going to happen is the patient's going to get all of your complaints, and they're going to tell them to all the other employees that are going there, and they're going to call to the office and say, hey, you know what? I don't want that person back here. When they're here, all they do is complain. So just leave those problems outside, keep it on a professional level, and things will run a lot more smoothly. Letter E, another thing that we're supposed to do. We're supposed to sign our paperwork each shift correctly and accurately with black ink. Our shift time started the top of the hour, which is 00, quarter after, which is 15, half past, which is 30, and quarter till, which is 45. Make sure that those are the times that you're signing in. If you're assigned from 12:15 to 3:15, then your paperwork should say 12:15 to 3:15. Not nothing else is acceptable. Now, if that's going to change at all, we'll get to that. It's on here, but it should be called into the office, and it shouldn't be changed unless we're aware of it. Letter F, housekeeping. As a reminder, make sure that we're doing housekeeping in patients' homes. We vacuum Monday, Wednesday, Friday. We dust Tuesday, Thursday, Saturday. We change bed linens every Monday. We make sure that we know when the garbage has got to go. We can set the garbage outside every time we're there, every day. But we also have to know when the garbage got to go down to the front of the road for the garbage men to pick it up. And I usually try to put that on the paperwork there in the chart. If there's a problem or question you don't know about it, call the office and ask us. We can help you with that. Remember, housekeeping is the most important thing in the patient and family's eyes. So that should be very high on our priority list. Even though patient safety and employee safety is number one on our list, on their list, it's housekeeping. G, errands for the clients. Remember that we do go run errands for clients. We got to keep it at a minimum, though. I don't want people running every day. Our policy is 1 day a week we go to the closest grocery store, and every day we can go to the post office. I ask that if you're in a patient's home and we are running errands for them, that they keep a notebook on the counter, kitchen counter, and that every employee that's in there throughout the week, if you see they're low on something or out of something, jot it down. Either food or maybe cleaning supplies. Keep a list. That way, whenever the person is there and they're ready to go to the store, all they have to do is take that list with them. Makes it a lot easier. Letter H. Do call the office if there's a problem in a patient's home. What I have is employees that will call everybody else except for the office. They'll call other employees, they'll call the patient's family members, but they'll call the doctor, they'll call the pharmacy. And I'm not saying those things don't need to be done, but we have to be aware that those things that you're working on those things. So definitely call us. If the patient is upset and doesn't want you to call, as soon as you step out on the porch to go home, you get your cell phone, turn it on, and call the office and tell us. We're not going to get you in trouble. We're not going to go back to the patient and say something, but we have to know if there's a problem or a change in the home, so that we're not blindsided down the road. Letter I. Have a positive attitude and be friendly. That's very important. Our attitude should be always, I'm here to help. What can I do to help you? If a person goes into the house and they don't have a positive attitude, the patient's going to call us and say, you know what, I don't want that person, don't send them back. And that's their right in the state of Pennsylvania. You're not going back to that house. And then you're going to lose hours. And we don't want that. We want you to maintain your hours. Letter J. Always call line 1. Line 1 is the 438-1936 and the toll-free number. They both ring line 1. 24 hours a day, 7 days a week. Do not call any of the backdoor numbers. Don't call any other number. Letter K. Returning a phone call from our office promptly. I've called a couple employees recently, and the one had gotten her cell phone changed, so I couldn't get a hold of her. If you're going to change your cell phone, that's fine with us. Just make sure you call us and update us with the new number so that we can get a hold of you. Another one I've called on a Saturday, and I didn't hear back from her until Monday. I'm here to say that's not appropriate, ever. If I call an employee and I have a question or I have a concern or I have a problem in a patient's home or even a schedule change, I should hear back from that employee within 2 hours. I think that's reasonable. If you're in an area where there's no cell phone service and then you come into an area where there is cell phone service, we'll leave you a voicemail. We may even shoot you a text. But in all honesty, 99% of the time, unless you're out of the country, cell phone coverage has been getting a lot better around here. I should hear back from you within 2 hours. Letter L. Call the office when the client's on the floor. I had a patient where the situation where the patient was on the floor. The employee did the right thing, called the ambulance, called the family, but forgot to call us and tell us. I'm here to tell you that part of that whole process should involve calling us, even calling us first if the patient was okay, even though they're laying on the floor, before you call the ambulance. We got to get a phone call. Letter M. Another thing that we're supposed to do. I would like a valid reason when someone's going to call off. If someone tries to call off, it's because their cousin's in a hospital in another state. I'm going to say, you know what? That's really not a valid reason. Your patient needs you. You need to go to work. Now, if you're going to call off because your car battery is bad, and I'm going to also say, you know what? That's not a valid excuse either, because someone will come over and jump you. We may have to adjust at times of your shift, and we're willing to do that. And 99% of the time, the patients are willing to do that. We give them a call ahead of time. But a valid reason would be, you're sick and you're going to the hospital, or your kid's sick and you're taking your kid to the hospital, or your husband is sick and you're taking him to the hospital. Those are valid reasons. Something that you're going to be able to provide us with a written excuse. We just need to make sure that if you're going to call off, make sure you're following the policy, give us the 8-hour notice, and make sure that it's a valid excuse. Letter N, if you haven't already, do get direct deposit. This is an ongoing thing that I have to remind everyone, because we were always bringing new people on board. If you don't have a checking account or a savings account, go ahead and get the Walmart card, the check card, so that we can go ahead and load your pay right onto that credit card, and you can use it everywhere, just like a regular credit card. Letter O, do report clients that are verbally or physically abusive. One of the things that we don't tolerate is any kind of workplace violence here. And if a patient is being verbally or physically abusive, that's got to come into our office. Our management staff will take a look at that, and we will work on getting that corrected. But we can't correct it if we don't know that it's going on. Letter P, do orient a new employee correctly in the home. That means every employee has already been shown this is what you need to do. When a new employee comes in with you, you have to show them the paperwork, the monthly and the daily. We show them that here, but really hands-on in the home is much better. Show them how to fill it out correctly. Show them how to use the letters or symbols in the daily sheet. Make sure that you show them how to sign in and out on the monthly sheet. Make sure they're signing the daily sheet. And then show them the patient's routine. Every patient is different. You know, they all have different meal times, different preferences. Show them their routine for their shift. And if someone gets trained on a day shift, we may need to train them on an evening shift because the routine's different on both of those shifts. Definitely show them where the pill box is located, how the patient takes their medications. Show them where the cleaning supplies are kept, and show them where the food pantry is, and you know, their meal times and maybe their meal preferences and anything else that the patient prefers. Okay, good. Moving on to letter Q. Do show up on time and work your assigned shift. Recently, we've been getting a lot of employees that are coming at 5 or 10 after. They're scheduled at 9 a.m. They're there at 9:10. That shouldn't happen, and the only person that can correct that is you. So if there's a problem with an employee showing up late, we need to know about it. There is a disciplinary process for that, and we will follow that. So show up on time and work your assigned shift. If you're assigned till 1, don't leave at quarter till 1. Don't leave at quarter after 1. If there's a reason that you leave at quarter till 1 or quarter after 1, make sure that you call the office, and that's letter R, before you leave the patient's home. Because I can't tell you how many times I've called and talked to someone, gotten their paperwork, and they left 15 minutes early. The patient told them it was okay to leave. And they thought, okay, when I get home, I'm going to give Twin Oaks a call. And they forget every time. So make sure that you're calling before you leave the patient's home. Now on to the don'ts. Letters A through F. Do not. A, do not put a note on the chart without calling the office. That's important. We need to know what notes are out there on the chart. And what we'll do is we'll call other employees to let them know when they're going in to look for that note. Because if you're going to put something on a note, it's important and everybody needs to know about it. Letter B, do not give your phone number to the patients or families, because they will call you. They'll wait till it's your day off. They'll wait till it's nighttime and you're sleeping. Don't do it. You're going to save yourself a lot of headaches. Letter C, do not tell the family there's a problem without calling the office first. And letter D, do not pick a patient up off the floor or transfer a patient that cannot assist you with more than 50% of the workload. If you do pick a patient up off the floor, we still have a policy in effect. It is a $200 fine. That's across the board. It's not happened in the last 3 years that we've had that in effect, and I have not had to increase that at all. Letter E, sorry. Do not be mean or short with a client. They will not want you to return. And again, the patient's rights in the state of Pennsylvania, it's their right to choose who comes in and out of their house. Our attitude, that goes right along with our attitude, needs to be here I am to help. If they're having a problem and they're mean and they're upset, a calm answer turns away wrath. And that's something that we all need to be good at. Whenever someone's being upset and they're arguing or they're yelling at you, you need to respond calmly, respond clearly, and you need to also bring that to our office's attention, because that's not something that we're going to tolerate. But I need us to respond correctly. So this is about your response in a patient's home. And last, letter F is don't be late for a shift. On to number 8, our HIPAA privacy policy. All patient information is strictly confidential. Whenever you're discussing a client with other employees, make sure that no one else can hear you, or only use the first name of the client. Do not post anything about work or about your clients that you're providing care for online. Number 9, holiday rotation. We've got some big holidays coming up here. We've got Thanksgiving, Christmas, and New Year's Eve all together. If you are off on Thanksgiving, you'll be working Christmas, either eve or day shift. If you're off Christmas, you're going to be working New Year's, either eve or day shift. Most of our patients don't get services, or they have reduced services on the holidays. So, 50% of our employees are working every given holiday. And when you have patients that get less hours or less services on those days, that cuts that number down. So you don't need as many employees on the holiday to do that. But if it is your holiday to work, make sure that you don't make plans for it. You want to plan around it. The other thing I tell employees every year is if you have a preference to which holiday you would rather work, you are allowed to call that into the office and let them know. We will try to adjust that if it's possible. Last, on their letter C, you cannot make a special request on the holiday. We don't grant those on a holiday. Next page, office hours. That's actually number 7. Office hours are Monday through Friday, 8 a.m. to 4 p.m. That's when we should get routine phone calls. If you have questions about special requests, if you have questions about payroll, anything to do with scheduling, that should come in during regular business hours. If you call me or one of the on-call supervisors, 8 o'clock at night, and you're going to ask for a special request, we're going to ask you to call back during regular office hours. We don't even have the special request book. We don't carry that with us when we leave the office. Just the patient and employee information and the schedule. We have a 24-hour availability. If there's a problem with an employee or with a client, again, always call line 1 to get a hold of us. And if it's an emergency, you're at a home, patient's not breathing, you're going to call 911 first, then you're going to get a hold of the office. Next, number 8, our 2014 pay calendar. There should be a handout that you received today. Remember, employees are paid twice a month, bi-monthly. They're paid on the 15th and the last day of the month. Unless the 15th falls on the weekend or holiday, then it's adjusted accordingly. If it's a Saturday, you get paid on a Friday. If it's a Sunday, you get paid on a Monday. If it's a holiday, you'll either get paid right before or right after the holiday. Letter 9, we have a safety and PI committee here. There is some training required with that. We meet for 1 hour for each committee, total of 2 hours, once a month. Usually it's the 3rd week of every month. And if you'd like to be involved with taking a look at how we prevent injuries to patients and employees, asked one of the secretaries that you'd like to sign up to be one of the committee members for a safety and PI committee. You do get paid to be here for those hours, and you do get paid to do the spot checks out in clients' homes. That's to do the safety spot checks out in the clients' homes. Let us know if you're interested in that. Number 10, Twin Oaks brochures and business cards. Also some pens. Make sure you take some with you today before you go. How we grow is by word of mouth. Our employees out in your community hand out some flyers, hand out some business cards. If we are looking for new employees, especially in the in the Greene County area, Fayette County, we're kind of okay right now. We're pretty steady. When I'm at a grocery store and I help an elderly person with their cart or help them, to their car and load their groceries, I'll hand them a card and say, "Here you go. I hope you never need our help. But if you do and you don't ever want to go to a nursing home, give us a call. We can come out and we can help you cook and clean and stay at home. If you know anyone that's looking for a job, and you give them a brochure and they fill out an application, that ties in with number 12 there. There is an employee referral bonus. It's $100. If you refer someone and they stay with us for 6 months, you get a $100 check at the end of those 6 months. Let's back up here to number 11. We do offer the Aflac insurance here. Now is the open enrollment time between now and January 1st. There is also going to be available under the Affordable Care Act, starting now as of October 1st, all the way through up until March 31st. You can go into the exchange. The website address is right here, healthcare.gov, and you can go ahead and sign up to see if you're eligible for that or any other programs that they are offering online through the Affordable Care Act. If you sign up before December 15th, that will actually kick in January 1st. And if you sign up before March 31st, you won't get the penalty next year for not having health care insurance. And last on the list, we've got, next to the last, we've got open discussion, which after the DVD, if you have any questions, all you have to do is see me, see Dawn, or see one of the secretaries. That way they can discuss with you any questions, concerns that you have regarding the staff meeting. And last, you will take the annual competency test today. It's 120 questions. You can miss up to 30 and still pass. Most people might miss less than a dozen. It's the same test that we give every year, and that proves to the Department of Health when they come in and they look at your chart that yes, you know what you're doing when you're out taking care